Hello and welcome to our webinar on managing anxiety-related meltdowns. I'm Mandi White-Ajmani. I am the owner of Small Brooklyn Psychology. We are a psychology practice in Industry City in Brooklyn, New York, where we offer therapy and neuropsychological assessment to people of all ages, backgrounds, and psychological concerns. We have 7 clinicians on staff who are all wonderful. Myself, Natasha Brown, Jill DiPietro, Sam Janit, Deidre Edwards, Maddie Lawler, and Nav Gill. Maddie and Jill are going to be giving this webinar tonight. You'll see them in just a few minutes. They are absolutely phenomenal. For the rest of the team, some of us are neuropsychologists, some of us are therapists. We all have experience working with people across the lifespan, but we also have special training and experience to work with children and parents, including neuropsych assessments, as I said, and also assessments and therapy and parenting work for kids as young as toddlers. Now, this is the 5th webinar in our monthly series. Recordings for our previous talks are on our website at smallbrooklyn.com/services/talks. There's a number of different webinars there, some related to what is a neuropsych evaluation like? How do you manage other kinds of difficult child behaviors? How do you manage anxiety? Got a lot of anxiety happening this year, right? And then also mental health 101. What's behind mental disorders? How do we recognize them? How do we help? How do they differentiate from just normal range of development? So you can go and see all of the previous recordings for those at that site. This series is media sponsored by Park Slope Parents. They are our local juggernaut of a community resource. They have so much going on all the time: advice, classifieds, meetups, tons of information just like this, emotional and social support. So if you're a parent in Brooklyn, please take a look at them and consider joining. And then we are also sponsored by Premier Pediatrics, which is our local pediatrician practice with locations in Brooklyn, Manhattan, and the Rockaways. They give excellent clinical care, and they give extra special care to new parents of newborns in a program that they call the First Month. Our next webinar is actually going to be next month on April 14th, when Dr. Sam Janit is going to talk about how parents can cope with difficulty and take care of themselves. And we'll have the registration links up for those in a few days. And then during this talk, which I will turn it over to Jill and Maddie in just a minute, but if you have questions, type them to me in the Q&A box. I'm going to have my video off, but I'm going to be moderating the questions, monitoring the Q&A chat, and then at the end, I'll come back and we'll go through those questions and answers at the end. So now let's talk about Jill and Maddie. So Jill DiPietro is a licensed clinical social worker. She really specializes in helping to evaluate and treat kids with all kinds of issues, including ADHD, disruptive and oppositional behaviors. She has a real specialty in anxiety and selective mutism, autism spectrum disorder. She is very well trained in a lot of very research-oriented and supported treatments. So all based on cognitive behavioral therapy, but with extensions for helping children and parents. So for example, parent-child interaction therapy, PCIT, is a very effective treatment for helping young kids, toddlers through age 7, to manage difficult behaviors. Parent management training, PMT, SPACE, which is a program for parents to help kids, any age kid, with their anxiety. And then as well as doing individual therapy with kids too. And then Maddie Lawler is a licensed social worker. She came to us from, she was originally got her degree at Hunter College, but even before that, she was working at the Ideal School doing special education. So she has an education background too, which is really great for incorporating into work with kids. She has lots of experience helping with trauma using a treatment called trauma-focused cognitive behavioral therapy. And she's worked has a lot of experience working with kids with behavioral learning and social difficulties. She is also working with Jill to learn some of these more specialized treatments, PCIT, PMT, and then getting lots more experience with CBT. So I will turn it over to Maddie and Jill, and I will come back and be there at the end.
I'm really excited to talk to you today, or Maddie and I are really excited to talk to you about anxiety. Now, we named this talk Managing Anxiety-Related Tantrums. And while we're going to be doing that, we're also going to be talking about how can we prevent anxiety in the long term. So anxiety is really a word that we use to describe the system that helps us become aware of threats and danger. Ultimately, we do need some level of anxiety. We want to be aware of our surroundings. We know that if we walk outside and we don't look both ways on the street, it's not going to be helpful. We need to make sure that we're aware of everything around us. Negative thoughts tend to protect us. So in a lot of ways, those can be helpful towards us. Now, when children become anxious, sometimes those negative thoughts are getting in the way. Anxiety problems are incredibly common. We know that we see anxiety problems with about 5 to 10% of children. That means if you walk into any classroom, you're bound to see at the very least 2 kiddos with anxiety-related problems. Anxiety happens to be the number one thing that we see in therapy. It happens to be the most common diagnosis we see. It also happens to be the most treatable. So while it tends to be the most common diagnosis, it's the easiest to treat. Now, what we're going to talk about today is how anxiety presents across our kiddos, across different ages. Feel free to type us any questions you might have about what we're chatting about today, any questions you may have about how anxiety presents in your children and how you can support them. Now, we're going to dive a little bit deeper into anxiety today. So we know that anxiety has a big nature versus nurture component. What that means here is that if you have a child that is diagnosed, if you have a child that has a genetic loading for anxiety, there's a predisposition, a genetic predisposition for anxiety, that child is more likely to develop an anxiety problem or an anxiety disorder in their lifetime, okay? However, if you also have parents that tend to be anxious, we tend to accommodate anxiety-like behaviors. And we're going to talk more about accommodations as we go. What we know is that if you have a child who has a genetic loading for anxiety, and we tend to accommodate their behaviors, their anxiety-like behaviors, which we'll talk more about, that child may have an anxiety disorder in the future. Their anxiety may snowball, it may grow over time. If we don't have a genetic predisposition for anxiety-like behaviors, if we do not have a predisposition for anxiety, parents typically won't push their children over the edge to basically have a disorder or have problems with anxiety. What I mean here is that parents can be huge agents of change. Parents can really help their kiddos overcome their anxiety. It's really easy to think, if I can help my child overcome their anxiety, aren't I the cause of it? Or couldn't I be the cause of their anxiety? And that's absolutely not true. One of the things we're going to talk about today is really how to help kids learn how to tolerate their anxiety, learn how to tolerate these big emotions and these really big feelings. It's the best gift that we can give a child to help them learn how to tolerate their own emotions, their own anxiety. So we're going to talk about how we can begin to reduce anxiety accommodations. We'll talk more about that in a few slides. Now, those imaginary scenarios that we talked about earlier, right? Or that I mentioned, right? Like walking into the street. So kids with anxiety, or again, that predisposition for anxiety, they tend to go right to those imaginary scenarios, and they tend to have a more negative skew. I am leaving my parent at daycare, right? I'm saying goodbye. My imaginary scenario is, what if something happens to them? What if something happens to them when they're on their way home? What if they get sick? What if I can't contact them, right? Those imaginary scenarios are occurring in their head. And what we know is that kiddos that are anxious tend to overestimate the likelihood of negative events and really downplay or decrease the likelihood of positive ones. We think about anxiety as kind of like the great masquerader. It can present in many different ways. We as adults tend to think about anxiety in the most common way, right? Or not the most common, but the most kind of obvious way, right? So I see a child crying, I see a child shaking, they're clearly very nervous. That's anxiety. Certainly, it is anxiety. What we know, though, is that anxiety can present in many various ways. So anxiety may look like that cowering, nervous child in the corner shaking and crying. It may also look like a child who's irritable, who's throwing things around the room, who's drawing with crayon on the walls. They're throwing things on the ground. It may look like a child who is angry or grumpy all the time. It may look like a child who is unable to interact with peers or is pushing peers away in a maladaptive or unhelpful way. It certainly may look like sleep disturbances, eating disturbances. We tend to see anxiety in 3 different ways, or anxious reactions in 3 different ways. We have our most common, right? Our fight and our flight responses. We also know that there are many kids out there, and adults for that matter, that will freeze in anxious moments. What we're going to talk about here is really that fight response. But first, like I mentioned before, we're going to be sure to talk about how can we stop this snowball effect? How can we stop anxiety from growing and becoming too big over time? We're going to talk about how caregivers, how you guys, how parents play a huge, huge role in helping their kids learn how to tolerate anxiety. What we want to think here is really how does anxiety affect my child in these 4 different ways. So we know from our cognitive behavioral research, right, that our thoughts tend to affect how we feel, which tend to affect what we do or our behaviors. So as adults and as caregivers, we want to think about how is anxiety affecting my child's body? What occurs in her body? What occurs in his body? Does their heart race really fast? Do you see their hands clenching? Do they report a stomach ache? That's one of the most common things we'll hear from little kids, right? They are not going to say, I'm anxious, I'm nervous. They're going to say, my stomach hurts, my tummy hurts, I have to go to the bathroom, I have to go to the nurse. What's occurring in their thoughts? Unfortunately, we don't always know what's going on in a child's mind, but how does anxiety affect my child's thinking? Maybe I know that he's always thinking about the worst case scenarios. Maybe I know he's always afraid of what's going to happen next or thinking ahead. Maybe there's, some level of forgetting all of the positive events, all of the positive things around him, and really only focusing on those negative things. And then really, how is it affecting their feelings? What is affecting, or how is anxiety affecting how they feel? Are they more nervous? Or are they more angry? Are they more irritable? Are they more frustrated? And then really, how does anxiety affect their behaviors? For kiddos with selective mutism, for instance, an anxiety disorder that prevents kids from speaking when speaking is expected of them, right? Maybe anxiety is so high that they're unable to speak in school. They're unable to speak in situations where speaking is expected of them. Okay, again, if my body is racing, I can feel my anxiety, I'm thinking I need to get out of the situation, I need to escape or avoid the situation that's causing me anxiety. My feeling is I'm through the roof anxious, I'm nervous, I'm worried. My behavior could be, I'm gonna throw a tantrum to try to get out of this setting or this scenario that is causing my anxiety to skyrocket. That's that fight response. So as I mentioned before, Caregivers and parents have an incredible role in helping to shape their child's anxiety. When a child is experiencing anxiety, they're going to signal it to their caregiver. They're going to signal it to the safest person possible, and it tends to be their parent. Now, of course, anyone in this room, or not room, not just me, but anybody in this webinar, if you see a child that's anxious, right? Think about that kind of pure, obvious form of anxiety. We see a child shaking and cowering in the corner. Anybody that cares about any child is going to jump in and try to save that child, right? They're going to try to rescue them. That is what we're all programmed to do. When anxiety comes into play, it not only raises up a child's anxiety, but if you're observing your child in distress, your anxiety system, your nervous system is also skyrocketing. It's also through the roof. So parents really have a double whammy there, right? They're feeling really nervous and anxious just by observing their own child feeling really nervous and anxious. So it's in our nature to want to help them calm down. It's in our nature to want to take action and help them get out of this situation. It's really in our nature to actually maintain or reinforce anxiety, right? We want to step in, we want to help. But what we know is that if we're supporting or if we're helping kiddos get out of situations or avoid situations that cause them anxiety, we're actually just maintaining or prolonging that anxiety in that anxious moment. It's really like short-term pain for long-term gain. We have to learn how to tolerate the short-term pain so we can see that long-term gain over time. Again, I can't stress this enough. Parents are not at fault here. It is in our nature, it is our predisposition to jump in to save. Parents are a huge agent of change for anxiety. So parents are absolutely not at fault. Again, if you have a kiddo without a predisposition for anxiety, anything you do, you probably aren't going to tip that kiddo over into having an anxiety disorder. But if you have a kiddo with a predisposition for anxiety, the parenting process, again, that natural inclination to want to jump in, to want to help that child relieve their anxiety, may maintain that anxiety over time. This is a very classic cycle, right? I have an anxious stimuli, something occurred and I'm extraordinarily anxious. For instance, I was about to be dropped off at school, okay? That's my anxiety skyrocketed. And I cried, I screamed, I tried to get out of that situation as the child. My parent observing that tried to rescue me. Maybe they said, it's okay, we don't have to go today, we can go back home. Or I'll sit with you on the floor for a while and I can stay with you at school today. I know this is too hard. And then what happens there is the child is avoiding the anxious stimuli. That avoidance occurs over and over again. That anxiety is perpetuated over and over again. So when we're working with kids and adults with anxiety, we really want to work through what is making them so anxious and how can we work on those triggers in a very slow and gradual way. This again is much easier said than done, but what we know is that the greatest gift that we can give kids is teaching them how to tolerate and be okay with their anxiety and be okay with uncomfortable emotions. It's really difficult. So we want to try to help them get to that point. And we're going to talk a little bit more about what that means in a few moments. But anxiety hierarchy is a really nice way of just saying a very small kind of stepping ladder, right? How can we do something that's causing a little bit of anxiety, right? Maybe I sit with you for only 10 minutes and then I leave. And then how can we work our way up to some of those bigger anxiety moments? If a child's afraid of shots, for instance, we're never going to go take them to get a shot on the first try. We're going to say, okay, let's think about it. Let's watch some videos of kids getting shots. Or vaccines, right? Let's try to practice this a little bit in a less direct way. One of the biggest things that we want to remember is that kids with externalizing behavior, and I say externalizing behavior because in a tantrum, that's what you see, right? You see hitting, you see hurting, you see throwing, you see yelling and screaming. Kids with externalizing behavior require just as much empathy as those kiddos that are cowering in the corner. It's just Our system is not usually programmed to give those kiddos the same level of empathy. However, they all require just as much. So we really want to see those kids that are having a tantrum with the same level of empathy and kindness as we do with those kiddos with depressive symptoms or that more classic anxiety presentation. Alrighty, Maddie's going to talk a little bit about how to model positive behaviors.
Thank you. So as Jill was talking about parents being agents of change, this is the perfect opportunity to teach your kids those positive behaviors, the adaptive coping skills. So that might look like talking through your behaviors, your reactions out loud, which is not something obviously that people do, but it is a really effective way to model for your kids an appropriate way to handle behavior. So for example, to handle anxiety, excuse me. So for example, say you're cooking dinner and you leave the chicken in the oven, you forget to set a timer and it burns. That's upsetting, that's frustrating, right? And instead, what you might normally do, take a deep breath, maybe you roll your eyes, you start making dinner again, right? You kind of ride out the negative emotion and you move on, right? But those adaptive skills, our kids aren't aware of them, right? And the way that to make them aware of them, to be that agent of change, is to model that for them, right? To say, oh, I'm so frustrated. I hate when that happens. This is so annoying, right? Showing them that these feelings are okay and they're valid, but then also modeling ways to cope with them in an appropriate way. And so that is twofold in that it validates the feeling, but also provides a positive behavior. And there's a lot of tools out there these days for positive coping strategies in terms of deep breathing. There's a few belly breath videos online that you can find. There's muscle relaxation apps that you can practice with your kids each night, different ways to kind of model these coping skills in a productive way and to do it together. And this kind of shows your kids that your children that this is a valid feeling and that you're able to handle it, right? So as Jill was saying, you really are that the person that they're going to be turning to in these moments of anxiety. And if they know that you can handle it, they know that they can handle it as well. And when we're thinking about practicing these during calm moments, right? It's not going to be when they're escalated. That's not an effective time to engage. And same with adults. If you're frustrated, it's not helpful for someone to try and solve the problem right away, right? You know how to deal with it. You want to work through it. And so instead, it's helpful to kind of strike when the iron is cold, as it were, so that you're kind of, being able to practice these strategies in those calmer moments and being able to reflect on which skills you might want to use in different situations. So these are some of the common errors that parents make. And again, they're completely valid errors. And the first one that I want to talk about is protective statements. These are statements that are designed to shield your child from anxiety and protect them from their own emotions. What's totally reasonable about this is, like Jill said, it's really frustrating and upsetting to see your child in distress, right? So you want to kind of handle it for them, right? And this is one accommodation is even just this statement of, oh, you're too shy, like let's not go to that party, right? Or, oh, you can't handle sleepovers, it's not even worth it, right? Instead of kind of like Jill was saying, exposing them to certain things and challenging them to be brave in those ways. Demanding statements, on the other hand, are trying to teach your kids that maybe these it's not that scary, it's not something that you need to be worried about, but in those situations it does dismiss those feelings, right? So the protective statements show understanding, but they don't require bravery, whereas the demanding statements require bravery, but they don't show any understanding of what your child is going through. So instead we have supportive statements, and that's meeting in the middle. So I'm sure as a parent, you've said both protective and demanding and probably supportive statements too. And you're probably feeling that tug in different moments, right? Depending on your own level of frustration, what you can handle. And so these supportive statements kind of meet in the middle, right? It has that acceptance piece of a protective statement, but the confidence of a demanding statement, right? Like, you can do this, right? And so those statements look like like, I know that this is hard, but I also know that you can handle it, right? And so that combines that validation, validating their experience and understanding where the fear is coming from, but also showing your confidence that they can tolerate that anxiety. And you have to sell it, right? They're looking to you to see who, like, what they're supposed to do, how they're supposed to react, and who they're supposed to be. And so that's, you need to sell the confidence as well there too, and make sure that they can kind of understand, oh, I can handle this, right? And that comes with the modeling behaviors. You know, if they're able to see that you can confidently handle things and you're actively working together to address the anxious behaviors, then that will build the confidence there too, right? So some of these statements, it's hard, but you have the power to get through this. I know you feel worried and it's okay to feel that way. I know you feel like you need my help, but I believe in you. All of these statements really reflect that combination of acceptance and confidence, demanding both understanding and bravery.
Absolutely. I really love that saying of you're the mirror your child looks in to see who he is. Anytime we try to protect our kiddos from their anxiety, our messaging is essentially, you can't handle this. This is too big for you. This is too overwhelming. Let me try to rescue and save you from this situation that's causing so much anxiety. And so again, we really want to model and help them recognize they can work through this. Anxiety is going to come up in everyday life. We certainly need to learn how to tolerate it. So let me help you do that. One of the ways that we help parents do that is to help them learn how to reduce their child's learn how to reduce accommodations that they're making for their child's anxiety. Accommodations are actions we're either doing or not doing because of a child's anxiety. Now, again, accommodations can be very helpful and healthy. They can also be unhelpful or unhealthy. If you were a parent here of a child with anxiety, you were definitely accommodating, of course, right? And that's okay. It is okay to be aware of the accommodations that you're making. We just want to ask ourselves, how often am I making them? Why am I making them, right? Why am I helping my child to the bathroom when I know that she can go on her own? Why am I sleeping with my child when I know that she's capable of sleeping on her own, right? Why do I feel the intense pressure in my own body to pick up the phone every single time my anxious child calls, even though she calls me 16 times in 1 hour, right? All of those moments are unhelpful accommodations that we're making. Now, we really want to think about how can we make accommodations that are helpful or are working our way towards our ultimate goal of helping a child learn how to tolerate their anxiety. For that example I just gave, right? My child calls me 16 times in 1 hour. I typically pick up the phone every time because I know if I don't, they're just going to keep calling and they're going to call even in shorter, closer increments, right? So that's a really good one. A helpful accommodation may be I'm going to set times in which I'll call my child. I'm going to let them know ahead of time. I'm going to let them know, okay, I'm going to call you at 10, 12, and 3 p.m. And you're going to know that I'm calling on those times. We'll have a few moments to talk during those times. I'm not going to answer the phone otherwise outside of those moments. Now, if you're putting an accommodation like that in place, you're bound to get some pushback, which we're going to talk about in a moment. Remember, when we're starting to do this is really hard. Every time you get pushback, when you reduce an accommodation, when you use a supportive statement instead of a protective statement, there's a possibility you're going to get a tantrum, you're going to get a meltdown, you may get pushback from your child. If you get that pushback, it tends to go right to your anxious system, where then you doubt your decision or you doubt your own ability to follow through with the accommodation that you just decreased. So make sure that as you're doing this, again, you're checking in with, well, why was I doing that accommodation in the first place? Would I be doing this for my other children? Am I doing this only because of my child's anxiety? Right? It's really good to ask yourself some of those questions. Would I do this for another child, or is my child's anxiety so in control of even the way that I'm doing things that I feel the need to accommodate this anxiety? We want to slowly work our way up that hierarchy we described earlier. And again, this is super complex. So if you do need support or help creating a hierarchy, working through and need coaching on just how to actually maintain and stay consistent with a plan like this, that's what we're here for. So feel free to reach out. Of course, our contact information is at the beginning of this slide or these slides. With accommodations, we want to think about how can I shape and change my behavior versus my child's. We can't necessarily change your child's behavior. We can do all the behavior modification in the world, but really what we're doing in that is actually changing our behavior, right? We're changing what we say to them. We're changing what we do. We're changing how we respond. And so we want to focus our changes and accommodations based off of our behavior. It's not changing that your child washes her hands 15 times when she goes to the bathroom. That's your child's behavior. It's changing that you are not helping her with it, or that you are walking away from the bathroom during that time. So if we do get into the situation where a child is pushing back, a child is upset, a child is throwing a tantrum or a meltdown, we are, as hard as this may be in the moment, withdrawing our attention away from tantrums. We're withdrawing our attention away, although every single instinct in us tells us to help that child, to give them attention, to try to get them out of that anxiety, because we know, again, that short-term pain is going to lead to really long-term gain here. We want to instill in them, just like Maddie said, the confidence. You can handle this. You can tolerate this. I know this is really scary to you, and I believe in you. So we're going to withdraw our attention. Our attention means everything. Verbalizations, our eye contact, our body language, sometimes our body. Sometimes it's helpful to stay with an anxious child, but sometimes it's not. Sometimes our bodies being physically close to them is actually more anxiety provoking and unhelpful for them. So it might be that they're having a tantrum and we walk away and we walk into the kitchen. We still have an eye on them. We're still keeping them safe. We're still watching them, but maybe we're focused on something else for that short period of time. We can, in these moments, provide one supportive statement. The supportive statement is certainly helpful for your child, but sometimes it's also a really nice way to help us recognize, okay, I told them, I validated their feelings, I instilled the confidence, right? Again, buddy, I know this is really scary for you, and I believe you can do this. I know you can. I love you so much. That supportive statement can sometimes help the adult as much as it helps the child, to be honest. Remember that anxiety, when your child is anxious, therefore you're anxious, anxiety is really activating their nervous system, and our bodies have a natural way of actually helping us kind of calm down. When a child is experiencing a tantrum or a meltdown, our bodies are actually working through it in that moment. And so we want to allow the child's body to do what they need to and to help them kind of calm down and react and readjust and get to baseline for their system. So a child's body is really working to decrease those anxiety levels on their own. Keep in mind, when we do withdraw our attention from anxiety-related behaviors, we can see what's called an extinction burst. We would see this with any behavior. It sometimes will get better before it gets worse. We want to be prepared to kind of ride the wave. We want to be prepared to kind of, get through it. We want to be prepared to kind of see it towards the end. What goes up must come down. Therefore, there will be an end to this as well, in which case you can praise your child for bravery, for calming their body down. We always want to follow active ignoring with that active part towards the end of, I love that you calmed your body down. You were so incredibly brave. I love that you're so nice and calm right now, right? We want to make sure that we're really coming through with a big praise towards the end. When we are engaging in active ignoring, we want to, of course, make sure that we're praising once children are calm. Again, we want to help them after they've calmed down a bit. We aren't really able to help them as much in the midst of a tantrum. I know that's incredibly difficult to digest and to hear, and it's the truth, right? If any of us were screaming and arguing and yelling and upset and just spinning, right? Nobody could help us in those moments. They could help us afterwards. They could probably help us before, right? That's why we really want to become aware of actually identifying some of those triggering moments and helping kiddos learn how to adjust their thinking in those moments, help them develop appropriate coping skills. But we can't do too much in the midst of a tantrum because it's not our child, it's their anxious system, right? It's their anxiety system just going into overdrive. So we really want to make sure that we praise a child at any moment of bravery, any moment where you anticipate them being anxious. We want to make sure we're praising bravery, flexibility, anything that you can. During that active ignoring period, feel free to direct your attention elsewhere, right? You can get really involved in a game. You can try to redirect them in a different way, not necessarily calling attention to them because, again, they're going through their own process, but you could certainly pick up some toys and start playing with them. Once you see them start to calm down or come to, you can give them lots of praises. You can describe your own behavior. Severe behavior may occur during an anxiety-related meltdown or tantrum. Statements and thoughts of self-harm and suicide are common in kids, unfortunately. And while they are common, they're never threats that we want to take lightly. We always want to take them pretty seriously. We control for safety no matter what. So number one, we always want to make sure that we're doing everything in our power to keep our kids safe. If we have any concerns about self-harm or suicide, we have to do our due diligence, bring that child to the emergency room. We have to make sure that we're connecting with mental health professionals immediately. We need to ensure that we're keeping our kiddos safe. Supporters can be really helpful here. Supporters are just simply family members, grandparents, extended family members, friends, family friends, anybody that you can kind of bring into the fold and let them know, my child is going through anxiety. We're working on this, right? We're working on, again, something like him going upstairs on his own or sleeping on his own. And it's really, really scary for him, right? It's really scary and it's nerve-wracking. And we also know he can do it. And so we might call you, right? And if we call you, we want to make sure that you have a statement ready to go and you'd be able to give our child a little bit of extra support. So it's not just coming from parents. Supporters can come in really handy because it reinforces the message that when everyone's calm, we do know is best for children, but it's really hard to actually do in the moments where kiddos are not calm. Right, so a supportive statement, an example of this for a child that was having a really hard time with their OCD and wanted their parent to complete a ritual, for instance, right? It's our responsibility to keep you safe. And if you threaten to hurt yourself, we have no choice but to take it seriously. We know your OCD can be tough sometimes. We're all here for you and we love you. This is a statement a grandparent actually called and gave to a child who had threatened self-harm because of the accommodation that their parent was decreasing. So because the parents stopped the ritualized behavior or reduced the ritualized behavior, that child escalated. Again, that was to be expected. We're helping that child recognize your OCD, right? It's not you. We're helping you overcome and tolerate this OCD, this anxiety. It's helpful too for little kids sometimes to talk about their OCD or their anxiety in kind of like an externalized way. That tends to work really well with little kids, especially like have them draw like their worry monster or have them draw, their OCD monster. That's a really nice thing that kids love because it externalizes it. It gives it a name. Something else that's helpful with little kids is giving them almost a time to worry, like a concrete time that they can look forward to each day. All right, at 6 p.m. every day, we're going to spend 15 minutes just writing down our worries. We're just going to focus on our worries, all the worries that went through our head today. And then we're going to close that box and we're going to come back tomorrow. And so again, this is externalizing the worry. It's not necessarily the child. It takes the blame, if you will, off the child if they're having some self-blame or some self-doubt about their own worries and anxiety. And of course, they're probably feeling distress. And really what it does is it externalizes it. So it's not them, It's my worry monster. It's this person, right? That's controlling my brain in that way. So that can be really nice for little kids. Another way to reinforce bravery and flexibility and a calm and safe body is to use a behavior chart with rewards. We don't always use this with anxiety. We certainly don't have to. Think about it as almost like a cherry on top, another layer of reinforcement for a child that's experiencing anxiety. Again, we want to start with where the child is at that moment. So start very small behaviors. It may be, again, maybe calling mom 10 times instead of 20 times that day, right? Really tiny behaviors. We can kind of gradually work up the hierarchy of anxiety. We love personalizing charts. Maddie's going to walk us through a few charts in a few moments. We want to keep a kind of robust reward system for our children whenever we can. So we want to, have social reinforcers when that's appropriate post-COVID. We want to have activity reinforcers, right? We want to have movie night, pizza night, fun activities that we can put on a rewards menu. We want to make sure that we have a couple tangible reinforcers if that's in line with what your home believes, right? A little grab bag, a little toy that we can work towards. We want to review success every single day. So we want to review how well your child did, what bravery goals they accomplished. With those two E's are really what are supportive statements, right? Empathy and encouragement. I know this was so super hard and you were so brave. That was incredible. Once a goal is about 75, 80% compliance, we want to really switch it up to a new goal. So we never need a goal to stay on there for longer than need be. Behavior charts are not going to college with your kid. They're really just to target a small subset of behaviors that we know that they need help on, and then we want to replace it with a new goal. And maybe, again, it's one anxiety behavior, and then we replace it with a new thing.
Awesome. So these are some examples of behavior plans. This one is used more for younger kids. As you can see, it's only targeting one behavior, right? Staying in bed. And that is a really challenging behavior. It can be very stressful for parents. And so that is usually one that we like to give you support with as a therapist. It's because it is such a stressful behavior. But this is usually a good one to target one at a time, especially for younger children. Children are given a daily reward and immediately as possible. And so, when the child stays in bed, they get to color in their heart and then they earn a lollipop. And kind of like Jill mentioned on the last slide as well, this is always done in conjunction with the other strategies, right? It's never just the chart. Some of the other strategies could be rehearsing the bedtime routine during the day, again, in those calm scenarios when they won't be escalated, role playing what it looks like to stay in bed versus leaving. Role playing can be really fun for kids. It feels really silly, but it is a great way to kind of model what that behavior looks like, limiting the attention, as Jill was saying too. And all of this is also in conjunction with the praise that Jill was speaking about, right? Like when they do stay in their bed, you really need to be layering on the praise in those moments as well as a continued positive reinforcer.
Yeah, we tend to also see a lot of like reassurance seeking during bedtime, right? Like, are you coming back? What time is it? What time are you going to bed? What am we going to do tomorrow? Right? A lot of those questions, it's to keep you there. Again, it's really helping that kiddo learn that they can tolerate that anxiety even during bedtime. So letting them know kind of a rule of, I'm going to answer 3 more questions and then I'm going to go back to bed. You're answering that in a calm way, if possible, right? You're letting them know in a calm way because it was rehearsed before. It makes it all a little bit easier in the moment.
Absolutely. Yeah. And so this is a behavior chart for older kids, usually 7 and up. As you can see, it's targeting 3 behaviors. So these charts tend to target multiple. This one's targeting following directions, remaining calm when frustrated, and bravery practice. They have an opportunity to earn their rewards twice a week. So this is used in conjunction with a rewards menu or a rewards chart so that they can kind of earn points as they go along. So they're earning their points twice weekly. The points are immediate, right? Right when they follow the directions, then they're granted their points, followed up with praise as well in this situation too. And again, these are in conjunction with strategies as well. And if we're thinking about anxiety and a behavior plan for that, bravery practice is a great one to have on there because they're able to try new things, stay calm, be flexible, and it could even be really specifically targeted to their specific anxieties. So if they are afraid of the dark, right, the behavior plan, like Jill was talking about the hierarchy before, maybe they are being in a dark room for 5 minutes, and then maybe it's 10, and then you're building your way up. But that's just a way to break down the behaviors a little bit more specifically and target them more piecemeal as well.
Definitely. And this one essentially works as having a tally mark each time it occurs. So it's a frequency count, meaning you can follow directions 14 times in a day. Each one would be a little tally mark in each box. And then they're all added up towards the end. It's kind of like a checkbook system. Not that our kiddos will need to use that in the future, but always good to learn, practice a little math.
So the next part that we want to talk about is the parental coping thoughts. So as we've mentioned, these anxious behaviors can be just as distressing for parents as they are for the kids, because it really is igniting the nervous systems, both in your child and in yourself. And so, this is hard to do. It's hard to, teach your child these behaviors and to challenge those fears and to be brave. And so these are some parental coping thoughts that you can turn back to when you are feeling stressed in some of those tougher moments. My child is acting this way due to her anxiety. I don't want to punish anxiety. I know this is hard for me. I know it will help him. All of these are the same kinds of supportive statements that you would say to your child, but you are dealing with it as well, right? And so in changing your response, you're encouraging bravery in them, but it can be difficult. And so back to that short-term pain for long-term gain, while this is difficult, the payoff will be great in that you are able to address those accommodations, and reminding yourself to stay calm even in those frustrating moments will model that for your child and show confidence in their ability to manifest the positive behavior as well.
This slide is a great reminder of needing to put your own airplane mask on before putting it on your child. Again, as difficult as that would be, and most parents probably wouldn't, knowing you should, and knowing, again, safety-wise, long-term health and safety-wise, right, you do need to do that. So I think it's a really good reminder of making sure that you're taking care of yourself. You're also meeting and modeling calmness for your child, again, especially as their anxiety system has skyrocketed. You do need to be the model of calm, cool, collected, and it's way easier said than done. So what we do with kiddos with anxiety is sometimes we'll work with the child themselves. Typically for this, we'll do it with kiddos 7+ in cognitive behavioral therapy, or cognitive behavioral therapies rather, and we'll use therapy to really work on the child's distorted or unhelpful thoughts. So their unhelpful thought patterns we'll try to work through with them individually with a ton of parent reinforcement, because ultimately we know plenty of adults that still struggle with anxiety and maintaining even frustration. And so we certainly can't expect kids to learn that in a vacuum. We need to support them and reinforce it around their environment. The services that we provide to parents would be parent management training, supportive parenting for anxious childhood emotions, or SPACE. These are parent-only interventions where we're just shaping our own behavior. Again, we're shaping the way that we interact and speak with our children. We're shaping the ways in which we reinforce or choose not to reinforce their anxiety. We're really working on reducing accommodations. This is incredibly anxiety provoking. So having the support of a coach, having the support of somebody to check in and say, this was an awful moment. He had a huge meltdown. I felt like I did everything wrong. And having us say, actually, you did everything right. Or that does sound really scary. It might be hard to do that again. Let's try to meet somewhere in the middle is really what we're here for. PCIT is a younger kiddo treatment. That is a treatment that we do for kids with disruptive behaviors as well as anxiety. That's for 7 and under. And that's a real kind of like live coaching right in the moment format and treatment when we work with parents and children together, but we're live coaching parents with a bug in the ear system. If you have any questions or want to reach out to us, our contact information is at the bottom. These resources here are phenomenal. Most of them are behind me, but these resources are really great in just making sure that you are working with your children to learn more about anxiety, to help them understand what anxiety is and how they can tolerate it better. The first 2, and the last one is parent focused. The 2 right in the middle, the what to do when you worry too much, what to do when bad habits take hold, are parent and child workbooks that you can do in tandem with your child. I typically recommend them every time I'm working with a family with anxiety. And then the last 3 down at the bottom are great children's books around anxiety. Start that emotional development and that psychoeducation early on for kiddos, again, toddler age. We really want to make sure that we're actually helping them learn about anxiety in an appropriate way, be able to identify those emotions. So now we're going to turn it over for some questions.
Thanks, guys. That was a ton of amazing information. Thank you so much. We do have a lot of questions here. And so, you guys gave such a fantastic framework for how to help meltdowns never even happen in the first place, or at least, over time, lots of work and all of that, but how to keep reducing them. And we talked about what to do at some points in the moment, like active ignoring and staying calm. But a lot of the questions are even more specific about like, what do you do when? So a lot of people are worried about how do you manage tantrums and how do you ignore tantrums when you're in a situation where they really cannot be ignored. So you might be in public. They might be hurting another sibling. They might be using a tantrum to get out of a chore that they need to do while the other kid is doing the chore, and it's not fair for this kid to use the tantrum to avoid doing a chore, things like that. What do you do when you just cannot just ignore the tantrum in the moment?
So public behavior is really tricky. Believe it or not, it's one of the biggest things that we practice in treatment. I go on the subway with people, I go to the grocery store, we go to toy stores because
I love that.
I miss it. It's so fun because what we know is that kids know we're in public. They know that it's going to be a lot easier in those moments to get attention, and it's going to be a lot easier to ultimately get what they want in those moments, especially if it is tangible, right? If I'm throwing a tantrum for something. So it's incredibly difficult to continue to ignore in public, and that's exactly what we would actually want you to do. As awful as that sounds. Again, I know this is so hard, and it's why we work on it every single day with families, because ultimately, those are the situations where we really don't want to signal to our child, you can't handle this. This is too scary for you. This is too big. Mm-hmm. We want to be able to sit with them and I recognize this is really scary, and I know that you can handle this. And so we're going to wait, and we're going to sit here, and we're going to try to handle it together. And as soon as we're calm, we'll be able to go to Starbucks and get a cake pop, right? Have some kind of even just thrown in reward that you've thought about right in that moment, if you can. And if there's ways to practice this at home first, if there's ways in which anxiety is going to be triggered in your child in public, in school, things like that, try to practice it in gradual ways at home. Try to practice and preview things ahead of time. The more positive antecedents we can put in place, like a routine, a schedule, previewing social stories where we really tell kids exactly what's going to happen in a social story. If you know that your child has separation anxiety, for instance, bring them to school on Saturday before it starts or Sunday before it starts. Do a walkthrough of the school, practice exactly what it looks like to get dropped off, practice being away from your child for a couple minutes and then return. So trying as much as you can to preview these things can be helpful. And in the midst of a tantrum, we want to help and be there physically, right? Be there for our kiddos in those moments and help them ride the wave with them. But really, that's the worst time to give into a tantrum, unfortunately. And with avoidance, it's really tough, but it's similar. Avoidance in terms of kind of chore, maybe less anxiety driven, maybe a little bit more kind of on the oppositional end, or I just don't want to do this, or I'm trying to escape or avoid this. In which case, you can certainly try to kind of create a system that works for that child, right? As soon as you do this chore, then you're going to be able to do this. So kind of like an if-then statement, right? If you do this, then you'll get to do this. So that can work in that scenario. Safety with sibling. Try your best to get the child or the other child away from the other sibling. Sometimes what this looks like is moving the child that is being safe into another room, and then sitting with the child that's being unsafe and waiting until they're calmed down and until they're safe. And again, if it does tip over into really unsafe behaviors, don't hesitate to take your kiddo to the hospital if need be, if you're really worried about their safety and harming others. Of course, none of us want to do that, and ultimately that's what they're there for. But
what about lower level safety behaviors, especially when they're directed towards you? Like a small kid is punching you, for example, and it's not really unsafe. They're not, but clearly you don't want that to happen, and it's hard to just ignore. What should you do in that moment?
So for an adult, I love a reverse timeout, especially with anxiety and anxious kiddos. So a reverse timeout, instead of putting the kiddo in timeout, which we can do for kids with anxiety, it tends to be a little bit messier. So we like to try to prevent it. However, we certainly can. But again, especially if it's an anxiety related tantrum, right? If you know this trigger is occurring, therefore the anxiety meltdown will occur, and it will co-occur with negative behavior or aggressive behavior, especially from a kiddo that we're not worried that much about safety, but we still don't want them hitting us. A reverse timeout, you put yourself into a room, and then you tell the kiddo as soon as their body is calm, you'll be able to return. Sometimes I do what's called like a silly little, like as soon as I hear a knock on the door, I know you're calm enough for me to return. So kind of like a behavior that we can see from the child in order to return. And again, in that moment, you're just showing the kiddo, this is unsafe. I can't allow you to hurt me. I can't allow you to hit me. I'm going to leave until you're able to be safe again. And then I'll come out, and then we'll be able to reset, and you model that reset as an adult.
Awesome.
Again,
Love
easy.
the idea of a reverse timeout, by the way.
Oh yeah.
Thinking about ways I can use it at home. All right. How about, I'm sorry, what?
I said reverse timeouts are great for moments where you feel like I am too anxious or I am too frustrated and I am going to say something I'm going to regret. I'm going to do something I'm going to regret. Reverse timeouts are a phenomenal resource that I highly recommend and use.
We should employ them more often. How about other sorts of in the moment things like helping, what are some coping tool? How do you, someone asked specifically, how do you know how to, like, what sorts of coping strategies will help with a kid in the moment? So not just ignoring, but then, for example, you have the kids who, maybe like having their back patted, and others who will be like, don't touch me when you touch them. So what are some ways of helping to elicit true calming behaviors from kids?
I think that this is a tough one. This is one that we had thought about including, but truly just to that example, right? It really does depend on the child. And I think that you guys know your children best. And so if you do know that something like a nonverbal gesture will help them, which in a lot of times it can, a nonverbal gesture is fantastic, right? Rubbing their back, letting them sit on your lap, hugging you. again, because you can couple a lot of that with good job calming your body down. I love that your body is so calm. You can couple that with a lot of labeled and specific praises. So those things can work well. But as you mentioned, there can be other kiddos that will be absolutely exacerbated and get even more upset and frustrated from that. So it's really tough to say.
And in that situation, when you have a kid who gets exacerbated or even tells their parent, go away, stop talking to me, stop looking at me, should the parent leave at that moment or no?
I would say that they can remind the kiddo, I know this is really stressful. I know this is really frustrating. And I know that you're okay right now. I know that, or maybe not okay right now, but I know that you can get through this. I know that you can work through this. I will be right here, ready for you as soon as your body and your mind are calm, right? I will step out of the room if that feels better, but you can absolutely follow the kiddo's lead. It's just that you want to be available to provide that praise and reinforcement once they start calming down. And once they're able, again, when the iron is cool enough to touch, we want to be able to go in to support them, to provide lots of love and reinforcement. We want to be able to help them learn appropriate solutions for next time this occurs. It's just in that moment, we can't do it. We typically can't do it, at least.
Got it. So we have some other questions that are more about how to recognize anxiety, both from the parent standpoint and from the kid standpoint. So for example, someone asks, I wouldn't have thought my 5-year-old was necessarily anxious, but he overreacts to small problems, is grumpy, and has been ignoring and pushing away friends. How can caregivers figure out what their kids are anxious about and how can they help?
Oh, that's a really good one. So that's a tough one. We don't always know if it's driven by anxiety. And we can help by labeling our own anxiety. We can help by labeling, again, things that make us anxious in our lives. The emotional development piece, especially, did you say that that kiddo was really young, 4 years old?
5, yeah,
Yeah.
5.
The emotional development piece there is really big too, right? A feelings wheel, starting to introduce them to those kind of feelings identification. Again, introducing them to that quadrant that I showed you earlier of, well, what happens in your body, right? Do you feel your heart beating really fast? Do you feel your head hurt really bad? Do you feel your cheeks get red? So trying to help them start to identify that. Cognitively, it's really tough for kids to be able to externalize and identify their thoughts at an early age, but we can identify our thoughts. So we can say to kids, I'm feeling really frustrated and anxious. I'm thinking about what might happen at work tomorrow because I have to do this meeting, right? So you can identify and start helping your kids by modeling your own thought patterns and even identifying negative thought patterns. But the emotional development piece is huge here. And ultimately, you want to help give them that language. Let them be able to say, again, I'm anxious or I'm nervous, or even help to identify ways in which maybe they might be anxious or nervous. Again, my tummy hurts. That's the most common thing we'll hear from kids that are anxious, right? My tummy hurts, my stomach hurts. That could mean I'm anxious or I'm nervous.
Makes sense. And then, so this other question, I think you've already addressed a lot of it actually, you can use to help kids to recognize their own anxiety, but what about behavior that the kid doesn't know is anxiety based? We've got generalized anxiety because of the pandemic that is resulting in an always angry 9-year-old. So helping to redirect some of that anger to recognize more of the worry that's underneath it.
Exactly. Yeah, exactly. And recognizing the worry, again, recognizing the thought patterns, recognizing more appropriate or helping them develop more appropriate coping skills, but then doing those coping skills with them, I think is one of the most important pieces there. Making sure that you're modeling maybe not being angry when you're anxious, right? And making sure you're tapping down your own frustration, or at the very least, verbalizing it a bit more, just like Maddie said, as awkward as it is to talk through those moments, like, oh, I'm so frustrated, I'm going to do XYZ, I'm going to do some belly breathing. That's exactly what we want to do. Kids are really hard to contain and teach them those skills. Think about how you can do it. If you're in the suburbs or parts of Brooklyn, right? Cars are fabulous to trap kids and teach them coping skills. If you can finally get your kids out walking to the park, you can try to introduce new family coping skills that way. So trying to teach them, again, less in a pointed, directed way, but more in a, we're going to learn this as a family so we can work on it and practice these things together. Maddie, let me know if you have anything to add to this. Sorry.
Oh, please. I think you hit it on every point there.
And then some questions in the theme of adapting for developmental stages. So for example, one parent asked, what's the best approach to take during fits for kids who are ages 2, versus age 4? So maybe like sort of pre-verbal versus more verbal sorts of kids. What are some differences there?
Mm-hmm. So the toddler age and younger, again, they're truly learning emotions. They're learning frustration. Everything is frustrating to them and nothing makes sense to us. Oddly enough, we stress the importance of parental coping skills more in toddler work than we do anywhere else in psychology, because toddler tantrums really don't make any sense, right? You're upset because you can't throw a ball out the 20th story window, right? Little things like that that are just so crazy to us.
Or I won't let you eat dirt. That was one of my favorites. Yeah.
Yeah, exactly. Right. Little things like that just make absolutely no sense. So for toddlers, we're helping them to really be able to identify their emotions. The supportive statements and particularly the labeling there makes is the most helpful for toddlers, right? Like, oh, it looks really frustrating, or I see you're really frustrated, trying to emotionally label what they're going through in those moments. Redirection is huge with toddlers. So if you can catch them in that moment, label their feeling and their emotion, and then help them redirect. So for little babies, we don't want to actively ignore in the exact same way that we do for older kiddos. For toddlers, we want to ignore in very smaller, short bits. So we tend to ignore in like 3 seconds rather. So like we might, for instance, if a toddler is like hitting us or upset with us, right? We might kind of like cup their hands and just say like, no hitting, and then turn our face away for a couple of seconds and then return our gaze, praise them for gentle hands. We might kind of show them, like do a more hand over hand action with a toddler than we will with an older kiddo. So it's a lot more hands-on. Toddlers also respond typically a lot better to that nonverbal reinforcement. So rubbing their back, giving their pats on their back, head rubs, whatever they need. They tend to respond a lot better to that typically. Again, depending on the toddler, certainly. And then older kiddos, again, we're working more towards kind of the classic skills of active ignoring. We still want to label and attend. For toddlers, we just want to do it at a shorter increment, shorter spurts. For older kids, we may do slightly longer to the ability that they can tolerate it and we can tolerate it.
Well, let's talk more about even older kids. That was another question that came up, is about like teenagers, for example. How do we handle teenagers?
Teenagers are tough.
Jumping around, slamming doors, big bodies.
Teenagers are tough, and teenagers do respond to consequences. And so for teenagers, we may want to think about some consequences, some privileges we can take away. Again, especially for some of those kind of concrete behaviors, like slamming doors, for instance, right? If you're slamming doors, if you're hurting something in the house, that's a pretty concrete behavior we can hold on to, and we can say, this is against our rules in our house. So if you do exhibit this behavior, there will be a consequence. Consequences should occur in pretty small bite-sized increments, right? Like 2-hour TV loss or 1-hour iPad loss. It should not go on for more than the day. It should not bleed multiple days. But teenagers, one, they deserve probably at that point their own individual therapist. They're working on that. And then ultimately consequences can work better for teenagers, especially more than other age groups. But we do want to use the same skills at the end of the day. We want to actively ignore, we want to praise. We praise in a more neutral way, certainly, right? We're not saying great job calming your body, but we're saying like, I love that you calmed down. I want to watch a movie with you as soon as you're ready to, right? So you're being a little bit more neutral in your praise, or as much as you can at least. But we do use the same skills throughout.
Got it. Any tips for middle of the night tantrums? How to avoid waking up a sibling or neighbors?
Oh, I hate this. So neighbors are the
Rugs, really, really thick rugs.
I know, it's true. Neighbors are the worst. Because if it were because in our truest format, we want to try our best to walk the kiddo back to bed if they're throwing a tantrum and coming out of their room. We want to try to, again, we may physically need to be there. That will depend individually on the child, but we want to not give a whole lot of verbalizations during those times. So if you're physically with a child, you could sit with them. If they absolutely need that, if you feel like they absolutely need that, or they're used to that, you could do that. That is an accommodation, but maybe it's a helpful one for you and your child, but you're not talking to them or you're not giving any information. You're really just trying to sit there and then help and then leave. At the end of the day, sleeping behaviors are really, really tough, but we want to become really ritualized and robotic about it as much as possible. The more that we tend to give attention, especially during nighttime, we tend to see it just kind of drag on. And so it may be that you have, or rather your neighbors have, a couple of weeks of really brutal screaming nights. But again, the goal is that kids can eventually regulate their anxiety systems. They have the confidence, just like Maddie talked about, they have the confidence in themselves to be able to do that. And then they no longer have that.
Makes sense.
All
right. One last question, and then I know we're already over time, but someone has a really great question about what kinds of things should we be watching out for when something is not simply just anxiety? Like if it's anxiety plus autism, for example, or anxiety plus ADHD, anxiety plus a mood disorder, what should we be watching for?
Yeah, it's a good question. So we really want to make sure that if we are concerned about those things, we do the thorough diagnostic or neuropsychological exam, just looking at other behaviors that are popping up. Of course, there are great ways and great thorough ways to diagnose those other disorders or concerns that you may have. But ultimately, we really want to think about intensity, duration, and impairments in terms of how much or when we may need to seek psychological or neuropsychological treatment and support. So intensity and frequency, right? How often and how big are these issues that are occurring? Duration, how long has this been occurring? And then impairments. Kiddos, their job is to go to school, to have fun, to make friends. We want kids to be able to do that. Anytime we think that some of these behaviors may be interfering with their job, their ability to do all of those things, that's what we think about for impairments. And so we really want to, again, if we see those behaviors occur, if we see those kind of domains being checked off, we really want to think about getting further testing and then being able to support our kiddos through therapy and being a part of their healing process. Kids, I always say in therapy, we want them to have a positive experience, because the likelihood that they're going to need therapy, especially in New York City, right, is extremely high in their lifetime. So even if your kiddo is in therapy for 8 weeks and it's short term and they learn a handful of skills, as long as they have a positive experience, we're doing our job, because we're showing them that that's who you can go to, that's who can provide support if and when you need it.
Makes sense. Thank you so much, Jill DiPietro, Maddie Lawler. You guys did a phenomenal job. So thanks for sharing all that really great information. Thanks to everyone who came and joined us for this webinar. Please feel free to come again when, on April 14th, when Dr. Sam Janit is going to be talking about how parents can take care of ourselves. Feel free always to reach out to us at Small Brooklyn. Jill and Maddie are happy to work with you. We are also happy to help you find the next step. So even if it's not going to be somebody in our practice, we can help connect you to somebody who can help you effectively. And thanks as always to Park Slope Parents and Premier Pediatrics for helping to get the word out about our series. Thanks everyone. Have a great night.